Thank you for joining today's educational webinar with Cancer Support Community Los Angeles. I'm Abby Espinoza, the Program Coordinator at CSCLA. I'm honored to welcome you to this week's webinar titled Tools for Navigating Your Cancer Journey. Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you would like to learn more about our services or watch past webinars, please visit our website at cancersupportla.org. Before I introduce today's speaker, please note that your video and microphone are automatically disabled for this webinar. You may, however, enter your questions into the Q&A feature found at the bottom of the Zoom window at any time. Questions will be answered at the end of the presentation. We may not be able to get to all your questions today, but we will get to as many as possible. It gives me great pleasure to introduce today's speaker, Dr. Philip Chang. He is an assistant professor practicing cancer rehabilitation medicine at Cedars-Sinai Medical Center. Following completion of his residency in physical medicine and rehabilitation at SUNY Downstate, he completed a fellowship in hospice and palliative care at Montefiore and a second fellowship in cancer rehabilitation at the University of Michigan. He has presented his work at national conferences, is published in several peer-reviewed journals, and is the chair of Program Development and Advocacy with Cancer Rehabilitation Physician Consortium. It gives me great pleasure to welcome today's speaker, Dr. Philip Chang.
Thanks so much, Abby, and thank you so much to CSCLA for coordinating this and for everyone who's decided and was able to join today. So let me just go ahead and share my screen here. Okay, I think that should be showing. I'm just going to go into presenter mode. Okay, just one more button press here, and I think we'll be good to go. Okay. All right, so this is going to be relatively brief, I guess, as far as presentations go, but really my goal with this is just to describe kind of some of the common complications that some people go through along the journey of a cancer diagnosis, as well as different tools that are available throughout the process for, whatever kinds of issues you might be dealing with. So I'm just going to be going over some of the common ones, and really I just want to really just stress kind of everything that's available, all the different resources that are kind of available, especially in the city like Los Angeles, for any problems that you might be dealing with. So just getting straight into it here, there's a lot of different things that can happen along treatment for cancer. And a lot of them are listed here. This is by no means a comprehensive list of things that can happen, but these certainly represent a lot of the common issues that I certainly see in my own practice and that patients bring up frequently. So some of these things are fatigue, peripheral neuropathy, anxiety, depression, other changes in mood, changes to appetite, as well as changes to bowel regimen, nausea, pain, changes to bone and muscle with usually kind of decreasing muscle mass and decreasing bone mass. So while all these things, may not happen to you or to, anyone that you know going through a cancer diagnosis and treatment, these are some things that could happen. But fortunately for a lot of these different issues, there's a lot of resources available. So I'm not going to go completely in depth into necessarily the treatment and evaluation of each of these issues, but more so, I really just want to tell you what's available and tell you who to go to that can help you with these kinds of issues if you are dealing with them, or if someone if you happen to be a caregiver for someone that might be dealing with one or possibly several of these kinds of issues. So the first one is fatigue. So it's almost universal that someone who's going through active treatment with radiation chemotherapy for cancer diagnosis experiences fatigue, and the fatigue is it's different than, normal fatigue. It's not related to kind of how busy or active you've been, and it's not really alleviated by rest. So if you take a nap or if you, go to sleep, when you wake up, you're still kind of tired. And this fatigue can be really quite debilitating to the point where, people can't engage in their regular day-to-day activities. They don't have the energy to go to the mall or to spend time with friends or their family. So there's, it can really be quite a challenge. But that said, there's also a lot of different things that can be done for fatigue. So this is by no means, again, a comprehensive list of the treatments. So there's even more stuff than I've listed here, but there are, many, many treatments available. So, from things like integrative therapies like acupuncture and massage, to things like physical therapy and exercise, which have really, really high levels of evidence of helping with fatigue. There are supplements like Wisconsin American Ginseng had one study, Mayo Clinic, that was shown to be quite beneficial. Sleep optimization, if you're not already sleeping well, diet optimization, other kind of modalities like bright white light therapy. And then, of course, there are medications that can be given. And a lot of times people don't need these kinds of medications, but these are kind of stimulant medications. Some of them are given for disorders like narcolepsy, but for people that have kind of more persistent or severe fatigue, these types of medications can be quite beneficial. And then certain kinds of psychotherapy, such as support groups or having a therapist or even journaling has pretty good evidence showing that it can be helpful for this kind of fatigue. So if this is something that you or someone that you know is dealing with, again, there's many, many different interventions for it. And especially if you haven't tried anything for this yet, or you if you haven't tried anything for this yet and are looking for support, there's definitely people that you can talk to. So one of the best groups would be to talk to your supportive care medicine team, or where at whatever institution you're receiving treatment at. They might be called palliative care. But if this is a group of people that you're not seeing, you can just ask your oncology team to be referred to them. It's more likely than not that these services will be available to you wherever you are receiving treatment for cancer, and they would kind of be one of the #1 people to talk to. If you are by chance having your treatment at Cedars-Sinai, then we actually also have cancer rehabilitation medicine, which is my specialty, and we would be more than happy to assist you with fatigue as well. They may have I think at Loma Linda, they also have cancer rehabilitation medicine services, and at some other institutions they may as well, but you can always ask anybody really on your treatment team if these kinds of services are available and to be able to point you in the right direction. So moving on here, another one that we get asked about all the time is peripheral neuropathy. So there are certain kinds of chemotherapy, particularly chemotherapies that are cisplatin-based or taxane-based, can really cause this kind of neuropathy because it's toxic to nerves. And kind of the most common symptoms that we see are sensations of numbness and tingling, usually in the hands and feet, although sometimes it can kind of extend further up the legs and further up the arms. And on occasion, not typically, but on occasion, the neuropathy can also cause weakness that can lead to difficulties with balance or difficulties walking or difficulties using your hands for kind of fine motor activities like typing, texting, or writing, or even picking things up and kind of holding on to things. So that can certainly occur in more severe cases. So again, this is not a comprehensive list of all the treatments available. There's many, many more things than this, but as you can see, even here, there are a lot of different things. We kind of divide the deficits that can occur from neuropathy into kind of functional deficits. So, difficulty using your hands or difficulties with walking or balance, and then kind of the symptoms that occur, which would be, numbness, tingling, burning, and pain. And, we want to treat both of those things. So you would use things like physical therapy and occupational therapy and therapeutic exercise to address kind of the balance issues and the difficulties with using the hands. And then for anybody experiencing the the actual physical symptoms of burning or pain. There's many different kinds of medications, as well as alternative therapies like scrambler therapy, which is a form of electric stimulation therapy that can be helpful for this. So again, if these are issues that you're experiencing, that your supportive care medicine or palliative care team would be an excellent person to talk to. You could also, in this instance, talk to neurology, because something important to keep in mind is it's not these kinds of symptoms, while they commonly occur because of chemotherapy, there's many other things that can cause this kind of neuropathy, including vitamin deficiencies or alcohol abuse or exposure to certain kinds of toxins. So certainly if it seems like the neuropathy is getting worse and you finished chemotherapy a long time ago, or you maybe didn't even receive chemotherapy, but you're still getting these kinds of symptoms. Again, there's many different causes for it, and a neurologist would be a great person to help work that up as well as provide treatment. And then again, people of my specialty, cancer rehabilitation medicine, would be able to help with these things as well. So if this is something that you're dealing with and you haven't really sought out any treatment for, there are tons of things available. And again, I urge you to reach out to one of these teams. And again, anyone on your oncology team would be able to set you on that path. Okay, so moving on, of course, mood symptoms are really common, and a lot of people have difficulties with anxiety, depression, and a lot of that is totally normal as you're kind of navigating, in many instances, kind of a life-changing diagnosis, as well as some of the difficulties with the treatments that can go with that. So again, this is not something, you don't have to just kind of resign if it's kind of more severe, and certainly if it's affecting your life or even just detracting from your everyday mood. This is not something that you just have to deal with it. There is a lot of help available for this kind of thing. And again, not a comprehensive list, but acupuncture has been shown to be helpful for this. Again, therapeutic exercise, and we're starting to see a trend that exercise kind of helps with everything, and that's true because it does. There are a lot of different kinds of medications, of course, for dealing with these kinds of mood symptoms. But if that's not your thing, or if you're just kind of tired of taking medications, there are a lot of other things available as well, in terms of psychotherapy or guided imagery, transcranial magnetic stimulation, which is available in a couple places in Los Angeles, has can be helpful for some people as well. So again, if you are having some of these people, hopefully we're starting to see a theme here as well. But supportive care medicine, palliative care, they are really good friends for all these kinds of issues. Psychiatry, there's probably a good chance that there are psychiatry services available at your institution. But if not, they could probably, or your oncology team could probably help you find a psychiatrist in the community. And then last but certainly not least, clinical social workers are really critical in this area. Probably the most important. A lot of clinical social workers are licensed therapists and can provide therapy for these kinds of mood issues themselves. And they really have all the keys and really the most knowledge in terms of psychiatry resources, as well as community group resources and support group resources that are available kind of in the city for this kind of thing. So if you're not seeing a clinical social worker and this is something you're dealing with, then I highly recommend that you reach out to one of them. And again, your oncology team could refer you. And then finally, spiritual care is another really great asset. And, there are a lot of people who may not necessarily even identify as being spiritual or religious or having any kind of specific faith background. But a lot of times talking to a spiritual care worker can still be helpful for you. So most of the times these spiritual care workers are multi-faith chaplains. So, they will be able to speak with someone regardless of their particular faith background. But this is something that may be available at one of your institutions. We do have it at Cedars-Sinai. So yeah, this can be helpful for a lot of people as well. Moving on, appetite changes and bowel issues are another kind of common occurrence. And kind of the bowel changes can usually go both ways, either progressing towards more loose stool or constipation. And a lot of times it is kind of walking a fine line between those things. And then in terms of appetite changes, more often than not, it's just people kind of losing their appetite, losing weight, and not being able to eat as much. And while a lot of that is kind of normal and kind of expected at times, it's certainly something that can be addressed as well. So again, whether you are dealing with constipation or diarrhea, there are numerous medications that can help with these kinds of things. And again, we want to be talking to our supportive care medicine, palliative care colleagues. And you also want to be informing your clinical nutritionist. It's very likely at your institution, there may be a clinical nutritionist available, and these are experts not only in telling you, how many carbohydrates you should be eating per day, how much protein you should be targeting for to, recover from surgery or to be regaining muscle mass, but they can also help with other issues like diarrhea, like nausea, by kind of talking about the different foods that may be triggering those things, as well as certain foods that may be more helpful for specific symptoms. For example, for people with diarrhea, they often talk about the brat diet with bananas and rice and applesauce. So there's a lot of things that our clinical nutritionist colleagues can do. And if you're having any of these issues, I highly recommend that you reach out to one of them. And then finally, a gastroenterologist. This is, you more often than not, you won't need to see a gastroenterologist, but if issues are particularly severe, then it wouldn't, it certainly wouldn't hurt to talk to a gastroenterologist as well, which is a specialist of kind of the entire gastrointestinal tract, so stomach, intestines, bowels. Next, we have nausea. There are a lot of different causes of nausea in someone undergoing treatment for chemotherapy. Some of the more common causes are just the fact that chemotherapy itself just directly triggers nausea by activating certain receptors at the level of the brain as well as at the level of the intestines. Some people who get immunocompromised because of the treatment that they're on, and when that happens, you can kind of get a thrush, which is kind of like an infection, a fungal infection, like of the mouth. And when that happens, that can sometimes lead to nausea. Some people can get inner ear problems like vertigo, which can contribute to nausea. And then a lot of times people, again, if you are having constipation, that is also regularly a trigger for nausea. And then for some people, there's something called even anticipatory nausea, where if you have like a really bad experience with chemotherapy and you get really, really sick from it the first time, then your brain kind of anticipates that the next time. And, even before you get the chemotherapy, you may start to feel nauseous just because your brain kind of remembers the difficult experience that was occurring the first time. So again, there's tons of different treatments for nausea. Most of them are medication-based, but there are some non-medication approaches for nausea. But I will say that if you are able to treat with nausea with medication, you can control it almost all the time. So this is definitely not something that you should be having to deal with or necessarily suffer through. Our supportive care medicine colleagues are probably the best people to talk to in terms of controlling nausea. But clinical nutritionists, again, can be very, very helpful in this regard. And also just your oncologist. A lot of times before you are getting your chemotherapy infusion, they will be giving you certain kinds of nausea medications preemptively to prevent nausea from occurring. And sometimes they can adjust those medications. So if this is something that's an issue for you or for someone you know currently, then I would, highly encourage you to be talking to all these different people. And again, more often than not, this is something that can be well controlled. Okay, pain. This is something that I deal with quite a bit in my clinic, and there are a lot of different reasons that people might have pain along a cancer journey. So more often than not, it's from the direct effects of the tumor itself. Sometimes it might be associated with a complication, like from neuropathy caused by the chemotherapy, or sometimes some people might have persistent pain after some type of surgery for a cancer or tumor removal. But no matter what the cause of pain is, there are many, many different treatments. And again, I've listed a lot of different things here. Some are medications, some are interventions like injections, and others are different kinds of kind of alternative modalities. But the point is, again, this isn't even the comprehensive list of all the different things you can do for pain. But if chronic pain or even acute pain is something that you are dealing with, again, there are many different specialists that you can talk to and many, many different modes of treating that pain. And again, it's not all medications. There's a bunch of other stuff too. So there are multiple different kinds of pain physicians. You could see someone like myself, a cancer rehabilitation medicine physician. Our supportive care medicine colleagues are also really good in this regard, and usually they more are experts in the use of oral medications for treatment of pain. There are interventional pain doctors who are usually trained in anesthesiology or physical medicine rehabilitation. And they will do kind of a lot more of these kinds of injection interventions, which can be very helpful for some people. And then, there are also pain psychologists who will kind of take a psychotherapy or cognitive behavioral therapy approach to pain relief. So kind of there's, no matter, how you kind of want to go about your treatment and, the kinds of interventions or medications you're willing to accept, there probably is at least something you can try. So again, this is not something that you just have to kind of continually deal with and struggle through. There are many, many different resources and therapeutic modalities for pain. So I hope I've been able to make that clear. Next, there is bone changes and muscle loss. So this can occur for multiple reasons. Bone changes maybe directly because of the cancer. So if you have a history of breast cancer, prostate cancer, those can commonly kind of spread to the bones and affect them directly. If you're on some kind of hormone therapy for breast cancer or prostate cancer, those oftentimes can also decrease kind of the density of bone, as well as kind of accelerate muscle loss. So those things are really common, and there's not as many treatments available for this, but there still are things that we can do, like making sure we're getting adequate amounts of vitamin D and calcium, which of course our clinical nutritionists can expertly advise us in. Therapeutic exercise plays a really big role here, and that's something that, again, a rehabilitation medicine physician or even our physical therapy and occupational therapy colleagues can instruct us in. And then there are certain kinds of medications that can kind of reinforce bone health. And these are things that an endocrinologist would really be helpful in. So again, if you are struggling with something like osteopenia or osteoporosis or sarcopenia, then yeah, I would say you definitely want to be talking to all these people, but especially for osteopenia, osteoporosis, it could be beneficial to ask to see an endocrinologist if you're not already on one of these kinds of bisphosphonate medications as directed by your oncologist. So with that, and you kind of, maybe I saw a running theme throughout that exercise is a treatment for almost everything. And it's kind of true that exercise really helps with almost everything. And it kind of brings us to, this phrase that exercise is medicine. And it really is. So I just wanted to take a few minutes to just really hammer down this topic. That exercise is medicine. While it's not everything and it's not going to cure all problems and make everything go away, it certainly is helpful. And I just want to try to convince you of that in the next few slides. So we know that exercise, it's really good for your heart. And this is demonstrated because we know that when you do exercise more, your heart rate decreases. It can lower your blood pressure if your blood pressure is high. If your blood pressure is low, you don't have to worry. It's not going to lower your blood pressure even more to a detrimental level. It increases your stroke volume. So the stroke volume is the amount of blood that your heart pumps out to the rest of your body with every time it beats, essentially. So that's really important because, or everything in our body needs blood in order to heal and live and really thrive. So the more blood that you're able to get out to all of your body and all the cells in your body, the better that is. And then exercise reduces the oxygen that the heart needs itself. So the heart is a muscle, just like any other muscle in the body, and it itself is dependent on getting blood, and it itself is dependent on getting oxygen. But when you exercise and do aerobic exercise, your heart becomes more efficient at using the oxygen, and it just doesn't need as much of it anymore. So exercise is medicine for the heart. It's also really, really good for our lungs, and it's been shown that the more you exercise, you are increasing the ability of your lungs to basically draw in more air, so you can get more oxygen, and again, give oxygen to all of the kind of cells in your body that it really needs. So, we just call that your vital capacity, which is kind of the amount of air that you're able to take in. Exercise is, of course, great for our muscles. So glycogen is the it's the way that our muscles store energy. And when you exercise, then you can increase the amount of energy that's able to be stored within your muscles. It makes more efficient the way our muscles are able to use energy. And it, of course, it actually increases the fibers of our energies and or the size of the muscle fibers rather. And then when we exercise, our muscles become more efficient actually at taking oxygen out of our bloodstream. So it's really, really good for our muscles, and it just makes them way more energy efficient. And finally, I just want to kind of hammer down that exercise is really, really good in cancer. And in particular, it's not good for, just because of all those other things I was saying, like it's good for your muscles, your heart, and your lungs, but it's good in actually like fighting tumor cells directly. And there's a lot of increasing evidence, particularly in like maybe the last 10 or 15 years, that exercise is able to control cancer progression by directly affecting the tumor. It can directly affect and regulate tumor growth. It can alleviate a lot of those complications like fatigue and bone changes that we were talking about. And it can even potentially improve how well cancer treatment works. I'd just like to go over a few studies that kind of demonstrate this point. So this is one very interesting study that was done where they gave rats lung tumors. And they divided the rats into two groups. One group of rats was kind of more sedentary and they weren't really exercising or running. The other group of rats, they gave free access to a running wheel, so they kind of ran as much as they wanted to. So you can see this is the lung tumors are demonstrated by these areas of black. And you can just see this is the group of rats that did not run regularly. And this is, the group of rats that did. And you can just see, very markedly how different the tumor sizes are just because, these rats were running more. This is another study that was done in healthy young men. So they had some healthy young men do high-intensity interval training on bikes. So these were people without cancer. And after they exercised, they took their blood, they put it in a machine to spin it around really fast, and then they took the serum from that blood and they exposed it to these human lung cancer cells. And what they found was that there was something within the serum of the blood of these people who had just exercised that basically stopped these human lung cancer cells from basically growing and living. We don't know exactly all the mechanisms by which this occurs, but it's basically being increasingly demonstrated that when you exercise, it somehow is kind of activating the body's own innate immune system to be able to fight off tumor cells directly. It's, again, exercise is directly kind of affecting tumor growth here. And we really see this demonstrated because of the risk reductions that we see. Most of these are mild to modest risk reductions, around 10 to 20%. But if you do exercise regularly, it has been shown to decrease the risk of developing all these kinds of cancer, and specifically in breast cancer, colon cancer, and prostate cancer. It's been shown to reduce all-cause mortality, and specifically in breast and colon cancer. This is supported by fairly strong evidence. So we can see here, 48% risk reduction all-cause mortality in breast cancer, 42% risk reduction all-cause mortality in colon cancer. These are pretty substantial numbers, which I think really just demonstrates the effects that kind of we were talking about in those studies of how exercise can directly kind of inhibit tumor growth. And aside from affecting tumor growth directly, there's really, really good evidence of how it affects our quality of life. So again, exercise is one of the #1 recommended things if you are struggling with fatigue. Again, it can help with mood, it can help with lymphedema, it can help with your bone strength. Again, it's not the be-all, end-all, and it's not going to necessarily cure everything. But if it's something that you're not doing, it's certainly worth trying, because again, there's a lot of evidence that it can help with a great many things. Okay, so with that, I'd like to move on to kind of our last portion here about just talking about all the different kinds of rehabilitation resources that are available. So a lot of people have heard about physical therapy, for instance, if you have knee pain or back pain or you can't walk well, but there are several other kinds of therapy that may be available to you that you should definitely be taking advantage of if you are having some of these kinds of problems. So again, physical therapy, it's kind of common and it's kind of all over the place. So no matter where you are, you should probably be able to find a physical therapist either at the institution where you're receiving treatment for cancer, or just even in the private setting. There's probably a physical therapist somewhere close to you. And again, they really focus on things like relearning to walk, if you're having difficulty like standing up from a chair, if you are having reduced range of motion, for instance, like in your neck or shoulder, if you have head and neck cancer. And then they can also help with all sorts of pain issues, particularly pain caused by musculoskeletal problems like low back pain, like you strained your back, or if you have arthritis in your knee, or if you sprained your ankle. They're really, really great for helping with all these kinds of issues. Pelvic therapy is a lesser known therapy, and this is a kind of specialty therapy, and they really specialize in helping people that are having troubles with urinary incontinence or bowel incontinence. If you're having any kind of pelvic pain, pelvic therapy can be very, very helpful, and they will do a lot of things like therapeutic exercise, something called biofeedback, manual therapy, where they kind of get their hands on you to kind of loosen up areas of stiff muscles at times, electrical stimulation, and they do many more things. But if you're having anything to do with this, or particularly if you have these kinds of issues like following radiation treatment to the pelvic area, or surgery to the pelvic area, then I highly recommend that you discuss with your medical team about being referred to a pelvic therapist. Occupational therapy, I would say, is probably the second most common form of therapy. And while there are a lot of them, they're not as commonly found as physical therapists. So more often than not, you may need to be reaching out to a larger kind of hospital system to find this. But again, it's pretty common, so it shouldn't be too hard. But they are experts more in activities of daily living. So things like showering, dressing, eating, driving, cooking. If you're having difficulty, or if someone you know is having difficulties with any of those things, then an occupational therapist would be the best person to see. Physical therapists tend to concentrate more on kind of strengthening the lower body. An occupational therapist will more often focus on strengthening the upper body, so like the hands and the arms, so they can really help with those areas, and they use a lot of the same tools and modalities that are used by physical therapists. Hand therapy is a specific form, a subspecialty of occupational therapy, and they go through a ton of training just because our hands are so intricate and we use them for so many different things. So they're really focused on hand function, including strengthening if you have specific hand or wrist issues like carpal tunnel syndrome or trigger finger or de Quervain's tenosynovitis. A hand therapist would really be the best person to see, and they use all kinds of creative modalities. This is a picture of somebody using paraffin wax, which is used as a heating modality to kind of help heat up the tissues of the hands, which can be really, really helpful if somebody has hand arthritis or if they are stiff and they're trying to stretch it out more. But they will, use all sorts of different modalities and exercises to kind of help you get your hand function coordination back. Moving on, lymphedema therapy may be something that some more people are familiar with. So lymphedema therapists are more difficult to find, but a lot of times if you're maybe in a more remote area, then I would recommend using this website, clt-lana.org. This is one of the credentialing bodies of lymphedema therapists, and you can just kind of type in your zip code and try to find a lymphedema therapist near you. There are other credentialing bodies for lymphedema therapy, so a quick Google search could also be helpful. But lymphedema therapists are really, really helpful for combating swelling that's caused by lymphedema. Lymphedema is basically when you have damage to your lymphatic system. And when you have damage to your lymphatic system, it can cause swelling, usually in like an arm or the leg, but it can also occur like in the chest wall area. But they do something called complete decongestive therapy, where they do these kind of gentle stroking massage techniques to kind of drain the excess fluid back towards more open channels so it can get back into your circulation. And these are also the people who will really do the fitting and measurements for compression garments, either in the legs or the arms. They can do compression wrapping if garments aren't quite indicated yet. And of course, they do a lot of therapeutic exercise as well. Speech language pathologists, finally, are also not as commonly found. But again, if you are looking in a larger hospital system, then it's very, very likely that they'll have speech language pathologists there. So if you're having issues with swallowing or speaking, then speech language pathologists would be the ones to see, but they do a lot more than this. They also do a lot of cognitive evaluation. So if you're having difficulties with like your memory or your attention, or you have chemo brain or chemo fog, or if you have just difficulties thinking and with your processing speed, then speech language pathologists can be really, really useful as well. So again, you generally need a referral to see any of these kinds of therapists, but it's something that anybody on your medical and oncology team should be able to provide for you. So again, how to access these resources, just ask your providers. Some of these therapies may be able to be provided at home. Yeah, just one thing really quickly here is most insurances will not allow you to get home services and outpatient services at the same time. So most of these kinds of services are provided on an outpatient basis where you'd have to go to like their clinic or facility somewhere. But some of them, like occupational therapy and physical therapy, can be provided in the home setting. So, if you are in a situation such that's very, very difficult to leave your home, you can still ask for these kinds of services, and they can put a referral for you to get them at home as well. So with that, I'd just like to finally go over a few community resources. So there are tons of well-being and survivorship resources. These are a bunch of the different programs, for instance, that we have at Cedars, many of them headed by my boss, Dr. Rosh Asher, including, classes for chemo brain, our super popular cancer exercise recovery program. A lot of people love our Nutrition Your Kitchen, which offers cooking demonstrations and many, many more. We aren't the only places to have these things. But these kinds of classes are widely available in a city like Los Angeles. Again, at your institution, I would say these are the most important things to really keep track of, to ask if, again, if you're going through any of those problems, to ask for palliative care and rehab, interventional pain management, psychiatry, social work, spiritual care. and clinical nutrition. So some of these things may be available at your institution, some of them may not be. But again, you could always ask your treating team and find out. But more often than not, supportive care, clinical social work, and clinical nutrition will probably be available where you are. And then finally, these amazing resources from CSCLA, but also Magnolia House, WeSpark, and CanCare. There's so many resources out there, and a lot of them post-COVID are available virtually. So a lot of these places offer things like support groups, and mindfulness classes, and yoga classes. So there's so many things like this. I just encourage you to Google them, and it's really easy to get signed up and registered for these kinds of things. With that, I'd be happy to take any questions.
Thank you, Dr. Chang, for your meaningful presentation. So we do now welcome questions from all of you. So please feel free to type any questions you have into the Q&A feature found at the bottom of the Zoom window. And we got some questions during registration, so I can go ahead and start with a few of those. So one of the questions we got was, how can you best support people with neuropathy?
Yeah, that's a really great question. So for neuropathy, it really depends on the kinds of symptoms you're having. If you're having kind of more those burning, tingling, numbness symptoms, then it'd be really good to talk to either a cancer rehabilitation medicine specialist like myself, or a palliative care medicine specialist. But there are many different treatments for it. I'll just list a few really quickly. So like oral medications, we commonly give pregabalin or duloxetine or gabapentin, or amitriptyline. There's topical medications that you can use, like topical CBD and THC, derived from like hemp or marijuana. There is high dose capsaicin, which is derived from spicy chili peppers, which can desensitize your nerves. And then if you're struggling with things like functional issues, like difficulty walking or difficulty using your hands and impaired fine motor coordination, you can see a physical therapist, or an occupational therapist or a hand therapist that can help with those kinds of issues. I would start by kind of seeing a specialist, either in supportive care medicine or cancer rehabilitation medicine, and that's something that your oncologist could certainly do for you. I do see a couple questions in the question and answer box, so if it's okay, I'll just go through those. So the first question I see is, for radiation-induced brachial plexopathy, which is rare, how can you find a medical professional who's familiar with that and find a way forward with treatment of arm and hand pain, numbness, tingling, muscle loss, and muscle strength? So that's a really good question, and you're right, that is that is a very rare complication that we don't see too often anymore. And the truth is, more for something like this, you'll likely need a team, and you'll need to be following probably with multiple specialists. In terms of treating the pain, you would likely need to be seeing someone who would be able to manage some. Okay, so I'll say this. There's a lot of different causes of brachial plexopathy other than just radiation induced. So the best specialist to see for this would be neurology or a neurologist, an interventional pain doctor, a supportive care medicine doctor, or physical medicine rehabilitation doctor. If you're somewhere like with a lot of different kinds of subspecialties, like at a larger institute, then I'd recommend you see someone like me, like a cancer rehabilitation medicine doctor. But again, interventional pain management, supportive care medicine, and then neurology, and possibly just like a regular pain management doctor. And a lot of times for the pain associated with that, usually a lot of times it can be controlled with certain combinations of medications. In terms of muscle loss and muscle strength, that is something that you would need to be seeing like a physical therapist for, and possibly an occupational therapist. And it would just kind of depend on the extent of muscle loss and strength loss. I assume you've probably had an electromyography test done before to diagnose this, but if you haven't, then sometimes those tests can also be those tests can sometimes be useful in prognosticating, the extent of muscle recovery and strength recovery that can occur. And then I guess I think the last thing that I'll add here is there are some newer surgeries. There are some like very specialized like plastic surgeons who do like nerve surgeries. Sometimes they are orthopedic surgeons, but if it's like to the point or extent where there's like almost no function, and you can't like use the arm or hand at all, then it may be worth talking to your medical team about seeing a highly specialized neurosurgeon who can do these kinds of specialized nerve transplants. The next question I'm seeing is, do the treatments for neuropathy help to reduce or eradicate neuropathy, or do they just help reduce the symptoms? So that's a very, very good question. As far as we know, it just really helps reduce the symptoms. As far as we know, really, when neuropathy is caused by chemotherapy, the only way we can kind of address the source problem is by either stopping the chemotherapy or reducing the dose of chemotherapy. And depending on how bad the symptoms are, oftentimes that may be indicated. And it's something your oncologist will do automatically. But if you are having severe symptoms, or weakness occurring somewhere, and keeping the dose the same is just something that you want to be mentioning to your oncologist so that they're aware and they can talk to you to see if a dose reduction might be indicated. As far as we know, and as far as I know, there's not currently anything that's proven to kind of stimulate nerve growth or kind of really help nerves grow back faster. There's a lot on the internet, and there's certainly a lot of claims that certain kinds of supplements, very commonly like vitamin B12 or alpha lipoic acid, or like L-glutamine, can help with like nerve protection or nerve recovery. As far as I know, there's not very strong evidence supporting any of that yet. So a lot of the treatments that we talk about, like oral medications or these topicals, yeah, they're not helping the nerves to grow back faster or eradicating neuropathy. It's really just helping to reduce the symptoms. But more often than not, nerves kind of do heal, albeit very, very slowly over time, sometimes over the course of years. And as long as there's nothing new, insulting, or hurting the nerves more, a lot of times over the course of years, the neuropathy symptoms can kind of get better because the body is able to heal itself a lot of the time. Not all the time, but certainly a lot of it.
Perfect, thank you. We also do have another few questions from registration. So someone asked if you know of any free cancer rehabilitation clinics that people can access, or maybe some other resources.
That is that's good question. So in terms of rehabilitation, yeah, again, I would look at it more along the lines of kind of all the different aspects of rehabilitation. So there's like rehabilitation medicine, which would be kind of physician services. And then there's like, all the different kinds of therapies, so physical therapy, speech therapy, occupational therapy. There are very likely physical and occupational therapy services. In terms, if it's something like no insurance at all, then that is more difficult. That's not to say there aren't any resources, but that would more be things like looking online, and on YouTube there's like endless videos made by really, really well qualified physical medicine rehabilitation doctors and physical therapists and occupational therapists and speech therapists. So if it's like just kind of no insurance at all situation, then you could certainly look into that. But if it's something, if it's like you're on like Medi-Cal, it can also be harder to find, but a lot of times larger hospital institutions like Cedars-Sinai, they will see patients with Medi-Cal. But depending on your kind of insurance, a lot of times the easiest way is just to call them directly and to ask them exactly where you can go. But yes, that's a trickier one.
Perfect, thank you. Another question we got is, When someone is post-treatment, what types of symptoms should they look out
If you're post-treatment, and you didn't have any symptoms kind of developing along the way, then I would say hopefully you'll just be okay. But it depends on the kinds of treatment that you receive. So if you receive certain kinds of chemotherapy, particularly a platinum-based chemotherapy or like a vinca alkaloid, neuropathy can still occur even after you finish chemotherapy. If you receive radiation somewhere, even years later, it is possible to develop something called radiation fibrosis. It's not super common as much anymore, but it can occur even years down the line. And more often than not, it'll start as like a tightness in the area or a feeling kind of like a restriction in the area where you got radiation therapy. But I would say those are probably the only major things. And if you're done with all treatment and you have been for like a little bit, then I would say you're probably okay.
Thank you. And then one last question. In your opinion, what is the most important tool for navigating the cancer journey?
Yes, I'm going to say, yeah, I don't think there's one tool. I think it's a team. I think it's, yeah, I think there's multiple there's a lot of there's multiple different team members that you may need. So I'll just say it's the entire team. And that team obviously includes your social support network, including your own family and friends.
Yeah, thank you so much. So if we don't have any other questions, I'd like to open up our closing slide. Kathy, if you can share that with us, please. Okay, perfect. So if you would like to learn more about Cancer Support Community Los Angeles, you can go ahead and visit our website at cancersupportla.org. And if you have any questions, you can feel free to email us at info@cancersupportla.org. Dr. Chang has also agreed to sharing his slides with us. So if you would like a copy of that, you can go ahead and email us. And just a couple of announcements of some classes we offer. We have a new in-person Shakti Nam yoga class that's held on Wednesdays in our office. And that runs from 11:45 to 12:45. And then right after that class, we do have in-person Tai Chi, and that runs from 1 p.m. to 2 p.m. And then if you would like to go ahead, if you are new to CSCLA and would like to go ahead and become a member, you can scan that QR code that says new to CSCLA. And if you would like to register for one of our upcoming classes and look at our calendar, you can go ahead and scan that QR code that says register here. I'd like to thank Dr. Chang again for his time and his meaningful presentation. I know we all learned a lot today. And I'd like to thank our participants as well. Thank you for joining us, and we hope to see you at our next webinar. And I hope you all have a great rest of your day.